I'm standing for my diagnostics presentation today. So first off, the description of the diagnostics procedure, which is gram staining. So being able to identify and see the difference between both gram-positive and gram-negative organisms is that it's very important clinically because it has implications for how long a patient will be treated. Being able to identify, again, both gram stain and gram positive means that in some cases a vet can get the patients out on antibiotics as soon as possible. Treatment even before the actual organisms is identified. So gram stains are performed on many things, so biopsy, bodily fluid like ears, nose, snot, things like that, wounds. They want to look at the infection that's suspected, and from this they yield results much more quickly other than methods like cultures. So gram staining will let the vets determine whether a certain type of bacteria is causing the infection and what type of microorganisms is present. This is why any animal who is suspected to have bacterial infection or actually is having one should definitely be a candidate for a gram stain in clinic. So justification for the diagnostics procedure or test. So I've just got a list of advantages for you. So it gives quick results when examining infections. So like I said before, the ears, the wounds, the snot and things like that. It's especially important when infection would make a crucial difference in a patient's prognosis and treatment. So then the next one is simple and cost effective, which vets like, or vet clinics. So the procedure is performed to produce information regarding the type of organisms that are directly present from the growth on culture plates. Unlike some other alternatives, it is cost effective in identifying the presence of microorganisms in normal sterile body fluids. Next we have, it helps with determining appropriate treatments for infections. So it would not be clear whether an infection is caused by bacteria, fungi or viruses, and these kind of infections would be treated in different ways. Now with a gram stain, this will let vets determine whether a certain type of bacteria is causing the infection and what type of microorganism is present. So that means that they can get with a gram stain, they can get on to finding out what's actually causing the infection and what bacteria is there, so they can choose the correct antibiotic to give that patient, or even if they don't find an infection and they find something else, then they can determine what to do from there instead of just giving them an antibiotic. Next is, it allows for various methods of testing, and then we've got, it is basically a key procedure in identifying bacteria like I just stated before. And then next we've got when the diagnostics procedure or test is appropriate. So the gram stain is the most important staining procedure in microbiology and clinic, what I feel. It is used to differentiate between gram-positive organisms and gram-negative organisms. It is appropriate when you don't know what antibiotic to give the patient, as well as determining a treatment for that patient. Also, it's really good for recurring patients with skin allergies or ear infections. So again, doing the test to determine what actually antibiotic they need to get rid of that infection. Gram staining of snot wounds, important to be able to see what we're actually treating. This helps us to give the best effective antibiotic or to see if they actually need it or not, like I stated before. And then any contradictions of the procedure test. I've just come up with a few things, not many. So just it is significant limitations when used for environmental microbiology. It has a few side effects, it comes with certain types of risks, and it might lead to misinterpretation, but it's very low. Then introduction of new equipment and supplies. So we've just sort of listed of the materials that are needed. So we've got glass slides, which we already have here. We've got the Bunsen burner, the microscope, lens paper and lens cleaner, immersion oil, distilled water, and 18 to 24 hour cultures of organisms. We've also got the paper, and then we've got the stains. So we've obviously got primary stain, the second one mordant, iodine decolorizer, and secondary stain. So it's crystal violet, ethanol, alcohol, iodine, and saffron. So how to perform the procedure test. So I've just got a wee picture there, and I've also printed out from Gribbles how to perform a gram stain. So just like on my next slide, I've put the methods and the results, and then here we've also got pictures. So this is our gram-positive cocci, and then we've got gram-positive cocci in chains, and that is in clusters. Then we've also got gram-negative basophil, and then gram-positive basophil, and then we've got the Malassezia, which is normally found in ears, and then budding yeast is what you can see under the microscope, then gram staining. So I'll give that to you. And one here. Awesome. So expected results and outcomes. So showing us the colour and shapes of cells that we want to see and which type of bacteria is present. So like I just said, you've got the gram-positive cocci, you've got the rods, and so depending on what colour they are, it determines what bacteria it is. So showing us strep that is clustered, as well as staph that is side to side, and rods, and so we've just got gram-negative, and what the colour, so crystal violet, turn into this colour, iodine treatment, this colour, decolorization, which goes white, and then the saffron stain, which goes a pinkish purple colour. So any follow-up that may be required, so just a couple bullet points. So we'd need the vet to check up on what we have found on the slides, whether it be positive or negative, and then from there the vet will have to prescribe the antibiotic that they think would be good for this patient. So if it's positive for yeast, prescribe antibiotics, then follow-up would be needed to do another gram stain to determine whether the antibiotic prescribed is actually working. And then reporting and recording into the computer once results are complete, which I've just put a wee bit here. So about the reporting and recording, so how this will be done. So we've got with reporting, so just on a piece of paper, we'd have a printout with whether it be gram-positive, gram-negative, numbers of bacteria, things like that, what you see, the morphology, whether it be the cocci, the rods, just things like that, what organism they are. And also the numbers yeah, so we've gone over that. And then recording again would just be recording onto the piece of paper and then putting it into the client's documents on computer, so that if we need be, we can go back and look at them and discuss with the client of what we've seen and what we've found and what we think treatment from there could be. So cost of client and justification of the cost. So I actually emailed a company that does the gram stain kits, and they came back to me for all four crystal violet, decolorizer, iodine and saffron were $284.35, and I've also added a few things like the Bunsen burner and whatnot into that cost justification. So I've got it here. So for the purchase price with all four products and all the other extra things that we need for in clinic, like the paper, the Bunsen burner, all that sort of stuff. So I totaled it to $320. So as you can see, that cost per month would be $26.67. Estimated use per month, 35 days we get out of a kit, I roughly thought, and calculated cost per use was 76 cents, charge to client per use $1.37. Yeah, so just all those calculations there, and in the end with equipment purchase, so cost to service to the clinic is $25.89, so we charge the client $47.61, and then